Hi, I'm Sophia Valdebenito, and I go to East Rockway High School in New York. My question was, what do you believe is the dominating factor that is preventing minority groups from getting the vaccine? Like either their skepticism of receiving it or like the structural socioeconomic issues that you mentioned before.
Good, great question. Thank you. So both. It's the short answer, but let me explain. If we were to depend on the surveys that have been done, these are done by Kaiser Family Foundation, Pew, other organizations. Um, uh, the resistance or the hesitancy, as it's called, for getting vaccinated is the biggest challenge comes with African American communities. And I think this is rooted in the historical wrongs that the government and science have done the African American community. We need to acknowledge that, we need to own that and move on and be able to address the current crisis for what it is, because vaccine is already having an impact, we believe, and should be, the uptake is now what we're focusing on. There are other, I mean, not every community is the same. I mean, among Latinos, there's concern about their documentation status. Oh, are they going to take my name down and then come after me? I got a question like that from a scientist at the University of Chicago doing a talk. They're worried that the immigration for the system will come after the undocumented. As you know, Asian Americans have been subjected to xenophobic attacks, and we know the tragedy of the abuse of the native populations as well. So I do think the structural inequities and the historical wrongs play a role here, but we can address this. And there is good. The good news, one good news about it is, if you look at childhood immunizations, so measles, mumps, rubella, the standard, and tetanus and diphtheria that every baby gets in the US, there are no differences by race, ethnicity. In fact, the lowest group is whites, because that's where you have some groups that believe that, oh, natural exposure is better than vaccine-induced immunity. But it's all in the 92, 93, 95%. So we know that this can be accepted by the community. And then the final point I would make is that structural changes help. So let's say, I got vaccinated. I had to go like 3 or 4 times on the DC Vaccinate website before I could get an appointment. I was kind of thinking, oh, I can get an appointment within walking distance. Well, I gave up and ended up getting one, but it was on a Saturday, so that was convenient. I'm over 65, and I live in a zip code that was a priority zip code, so I was fortunate that way to be able to do it that way. But can other people do it if they don't speak English, if they don't have a computer, if they don't have broadband? Trying to do that on your phone and then pay for it because they don't have an unlimited data plan, or they try to call. I did call at one point to make sure that I was confirmed, because I figured, well, I never got a confirmation. And the first thing I heard was, there are 300 callers ahead of you. So how many people can sit there and wait until their turn comes up? So these are structural issues that if we can anticipate them, and I'm not blaming the DC government. Actually, DC has done fairly well with getting the vaccine out. We could have said, well, who should get this vaccine first? And health workers agreed, nursing home residents agreed, and then maybe it should have been, well, everyone over 65 it should be prioritized, and we need to make sure that we reach out to them proactively. Now, we don't have the infrastructure to do that, but perhaps this tragedy of the pandemic will allow us as a nation, as a government, and as a health system to be able to do that proactively. Because then you say, well, there's an 80-year-old who lives alone or lives with his 76-year-old partner, and they really, they don't even know what a computer might be. But we know they live in such and such an address, and we have health workers go out to their home and vaccinate them or offer them the vaccine, obviously. And that can make a difference. And I think that we're not ready to do that, but that would be, I think, a goal of a lesson learned from this experience. So I'll stop there. Thank you.